For instance, in the 2015 Addis Ababa Agenda for Financing for Development realized that governments are expending a lot of money to respond to diseases that are directly caused by tobacco exposure, especially in the cigarettes, and then decided to adopt an approach of raising taxes and having such money earmarked to finance perhaps non-communicable diseases. Other voices have said institutions can have that money collected through taxes either on sugary products, energy drinks, on salt, on salted drinks or snacks, or fatty edible oils, and such foods that cause disease, directly causing non-communicable diseases, or those products that are called lifestyle products, the alcohol, which cause disease. And of course, Uganda has also tapped into that in the HIV fund, where revenues are collected from water, all those products that are called excisable products, and a certain percentage is channeled into generating revenue to finance the HIV fund and respond to that challenge. Of course, also there is a need for collecting revenue from the externalities, factories that pollute the environment, or those that do timber. They are perhaps given a permit, and paying for that permit is non-tax revenue that is collected to finance a certain good. And also there is an environmental levy, which is a levy or revenue that is generated from people who are perhaps bringing into the country cars that emit carbon monoxide. Or even municipalities or urban cities have come up with, for instance, road tolls, because there's a direct pressure impacted on the roads through heavy tonnage. So road toll, in a way, is collected. But also there is another revenue stream, which is public-private private-public partnership on road user fees. For instance, Entebbe Express Highway, to access it, you pay for it so that you can help government also pay for that loan, that you are enjoying a very nice road. For the same, so you are part and parcel of those that are collecting revenue, which is non-tax. But also those who, for instance, academic institutions are helping Ugandan national, rather, this institution which manages higher institutions of learning, that when you're going to graduate, you pay a charge for purposes of helping you qualify or also authenticate your academic papers, and that money is paid to the higher institutions of learning. But also there is fees that you pay if, say, you want your academic documents to be certified, and that is revenue that would come to an institution to help it meet its other obligations. There is also fees that says being mooted on our national IDs, that you pay for it to get identification, so that government can generate money out of there, because the resource envelope is reducing, and yet government must look for a tax base. Of course, we have had citizens complain that they don't want to pay tax. Of course, that is not easy. People cannot be for sure motivated enough until when they start to see that they are their taxes are being accounted for. But also government cannot fold hands and continue to accumulate debt from outside, and yet it has citizens that need certain services. It has citizens who perhaps have disposable incomes that can be collected and distributed so that there is equity, that those that cannot afford can also have subsidies and also enjoy the same. But also those that cannot afford public education or public health are benefiting from the subsidies, or that there's a rich person or that can afford, that is helping government pay up. Of course, also there is specialized care, which is way too expensive for even the average, even the most wealthy of citizens, and government must help its citizens meet it. So that is why it comes up with mechanisms of resource mobilizing, because public goods are for everybody, they are not for individuals. So that is why resource mobilization is that central.